Date. It is Saturday the 4th of April. Now these are the total global cases from the 22nd of January up to today the 4th of April. And as we can see, there's been an exponential rise just recently, with the number of cases massively increasing. Now unfortunately, what I believe is going to happen is this is going to carry on increasing very steeply like this. Now the reason I think this is because there's going to be a lot of countries in the world that are going to fail to control this pandemic. Now, I think we will control it locally in certain places, but globally, I'm afraid it's not looking quite as healthy. Now, what I want to do first of all is look at a few numbers and figures. So really this is quite concerning, that the dramatic increase and certain countries, this is for the world, remember, certain countries are going to do much better than this, but other globally, I'll give you some reasons why I'm thinking this as well. Now today I'm going to do two videos, hopefully. This is the first one with a few bits of background, then I'm going to do a second one focusing on the United States and Australia, and to some extent the UK. So these are the official cases, these are the official deaths. We know it's way, way, way higher than this. 10, 20 times higher than that is the actual number of real cases in the world, unfortunately. Now, the World Health Organization has been saying some interesting things before we look at individual countries. Now, the World Health Organization has helpfully told us that the global risk assessment is very high. Sorry, I shouldn't be sarcastic. I think we know this, don't we? This is a serious matter. But we don't need to be told that. We know it. Supporting and protecting older people is everyone's business. Again, we know that. Ports, airports and ground crossings require careful monitoring. We know that. So really the World Health Organization in this update isn't saying too much new. But it is coming from their experts, so it is somewhat definitive, even though we've criticised the organisation itself. Now, cases starting to climb in Southeast Asia region is a big concern. So here we're talking about the Oceanic Islands, Borneo, Indonesia, Bali. And then we're also talking about Papua New Guinea, then going up into the land, Thailand, Cambodia, Laos, Vietnam, Myanmar, Cambodia. Countries around there, cases starting to increase. And unfortunately, that probably will carry on for a while. And the other thing that really concerned me about today's WHO briefing was the list of African countries. I'm not going to read them all out, but you can probably see them there. These list of African countries. Well, we'll mention them. South Africa, Algeria, Burkina Faso, Cameroon, Ghana, Senegal, Ivory Coast, Nigeria, Mauritius, Democratic Republic of Congo, Kenya, Rwanda, Niger, Madagascar, Guinea, Uganda, Congo, Togo, Zambia, Ethiopia, Mali, Tanzania and Malawi all have local transmission. Now, they're not quite saying it's community spread yet, and we'll look at how they differentiate, but what they're saying is that there's local transmission in these places. It's not just coming from overseas. So the situation throughout Africa is started. The curve is a bit behind Europe, China, the United States, but it is started. And it is remarkably concerning, the number of cases and the difficulty in treating those cases that there's going to be in these countries. Now, they are differentiating between local transmission and community transmission, the World Health Organization. What they're saying is local transmission indicates locations where the source of infection is within the reporting location. So people caught it within the reporting location, not imported cases. But they're stopping short of saying it's community transmission, which is evidenced by the inability to relate confirmed cases through chains of transmission for a large number of cases. In other words, with community transmission, you don't have an epidemiological link. So unfortunately, I think we're fairly safe in saying that the African situation is going to change from localised transmission to community transmission before too long, and I do sadly expect a great increase in cases in African countries. Now, the WHO has said some interesting things lately, actually, about the transmission. And we've got some new data on transmission from the United States in the second video today as well that I want to bring to your attention. But first of all, the World Health Organization is differentiating between symptomatic transmission, pre-symptomatic transmission and asymptomatic transmission. Now, we've done this months ago on this video series, but it's worth going through and just making sure we're in step with international thinking. So COVID-19 is primarily transmitted by symptomatic people who are in close contact, is what they're saying. Now, this is interesting. So what they're actually saying is it's transmitted primarily by symptomatic people. So what we could do now, what we're in a position to do now, is take a look at the graph there. And this is increasing infectivity, increasing transmission. And this would be, so that would be infection along there, and that would be time along there. So increasing infectivity with time. Now, the day we're sure about on this is day 1. So let's say that's day 1 there. Now, day 1 is when someone first becomes symptomatic. And let's say that's day 1 minus 7 there. And that's plus 7 there. Now, what the World Health Organization is saying here is that someone is most infectious when they first present with symptoms. So they're most infectious then. And then they stay infectious for a day or so. But then after 3 days, the level of infectivity goes down, is what the World Health Organization is saying. And they're saying that most people are not infectious by day 5 or 6. That's day 7 there. So to be safe, I would obviously leave it a bit longer. In the UK, we're saying don't go out till it's day 8 after the first day of symptoms. So we know that. But as we'll see later, because of pre-symptomatic transmission, then this doesn't start all of a sudden there. So quite what shape this curve is before then, we don't really know. But the World Health Organization are thinking it's something like this. So starting maybe about 3 days, 2 to 3 days before there. So suppose that's 3 days before. So what they're saying is people are most infectious just after they get the symptoms in this time period here. So this is when people are most infectious, in the first few days after symptoms. But they do carry on being somewhat infectious after that, up to 6 or 7 days to be safe, or 8 days to be safe really. But as we'll see, they are infectious before that in the pre-symptomatic period. But what they're saying is this is the peak time here when transmission is likely to occur, that first few symptomatic days. So if you're caring for someone at home, then that first few symptomatic days is the most infectious time. So that's worth knowing, that's worth bearing in mind. So COVID-19 is primarily transmitted from symptomatic people to others who are in close contact. Via respiratory droplets, yes. Via direct contact and via objects and surfaces. But we can also add to this from data that we're going to look at from the United States that this can be transmitted if you are close to someone just talking to them. It doesn't have to be coughing and sneezing droplets, just talking can be enough to transmit the virus if you are close to someone. The World Health Organization can confirm it's transmitted via objects and surfaces. Of course, we knew that. So this is what they've said. Shedding of the COVID-19 virus is higher in the upper respiratory tract from the nose and throat in the 3 days after the onset of symptoms. That's their statement. And that's based on a lot of expert opinion. So I'm quite happy to say it is highest then. Now, pre-symptomatic transmission. Now, what they're saying now is the incubation average is 5 to 6 days. So the average time for incubation from when someone is first exposed to the virus to day 1 when they develop symptoms is typically 5 to 6 days, but it can be up to 14 days. It would be unusual to be more than 14 days. So that's interesting. Most people who get this disease will have been exposed 5 or 6 days before. That's typical. And people have tested positive 1 to 3 days before they develop symptoms. So that's what we're saying here. So 3 days before people develop symptoms, here people have tested positive. And of course they'll be testing positive during this phase as well. But people are most positive, people have most of the virus 3 days before they develop symptoms and for the first 6 or 7 days after they develop symptoms. Now, that's not saying that the disease goes away after 6 or 7 days. It doesn't. We actually know the most dangerous period in this disease is the second week when complications are likely to occur. And it's assumed that the complications there are occurring due to immunological inflammatory changes, as there's inflammation. And the inflammation can lead to the collection of fluid in the lungs, as we've talked about before. I'm sure we'll talk about again, but the problem is that the inflammation can cause fluid in these air spaces, in the alveoli. But that tends to be worse in the second week. But by that time, by the second week, the people should be much less infectious. In fact, theoretically, according to this, they shouldn't be infectious after about 6 days after the onset of symptoms. So what this means is you could have people that are quite poorly, potentially in hospital, and yet essentially not be infectious or not be infectious. The degree to which they're not infectious is hard to say. I mean, even if there's a few viral particles left and you were undertaking aerosolization and medical procedures, there could be some risk. But they're basically saying the risk of infection is going down 6 days after the onset of symptoms. So that's what they're saying. Now, pre-symptomatic transmission, yep. So people have tested positive 1 to 3 days before. Asymptomatic transmission. Now, the World Health Organization are a bit more cagey about this. What they're saying is a few reports of laboratory confirmed cases who are truly asymptomatic. In other words, they've taken people who've been in contact with people that are known to have the virus. They have then tested them and found that they are truly asymptomatic. They have no symptoms, but the virus can be cultured from them. So what this means is that while most people get a mild illness, there is a minority that seem to get a truly asymptomatic illness. They get no symptoms at all. Why that is, I don't think anyone knows. And asymptomatic cases have been reported as part of contact tracing. That's what we've just said. So we can now say with, in a fairly definitive way, that the virus can spread for 3 days before someone develops clinical features and for 5 or 6 or 7 days after they develop clinical features. That's when we believe this virus is spread. Now, I've got a letter here from the Prime Minister. I kid you not. It's from the Prime Minister of my country. Now, to be fair, I think we might have sent it to 1 or 2 other people as well. In fact, 20 million other people. I'm writing to you to update you on the steps we are taking to combat coronavirus. In just a few short weeks, everyday life in this country has changed dramatically. We all feel the profound impact of coronavirus, not just on ourselves, but on our loved ones and our communities. I understand completely the difficulties this disruption has caused to your lives, businesses and jobs. But the action we have taken is absolutely necessary for one simple reason. If too many people became seriously unwell at one time, the NHS will be unable to cope. This will cost lives. We must slow the spread of the disease and reduce the number of people needing hospital treatment in order to save as many lives as possible. That's why we are giving one simple instruction. This is an order. You must stay at home. It couldn't be clearer. The government is ordering people to stay at home. And rightly so. You should not meet friends or relatives who do not live in your home. You may only leave your home for very limited purposes, such as buying food and medicine, exercising once a day, and seeking medical attention. You can travel to and from work, but work from home if possible, if you can. When you do have to leave home, you should ensure wherever possible that you are 2 meters apart from anyone outside of your household. These rules must be observed. So if people break the rules, the police will issue fines and disperse gatherings. I know many of you will be deeply worried about the financial impact on you and your family. The government will do whatever it takes to help you make ends meet and put food on the table. Then he says there's some additional enclosed leaflets for more information. From the start, we have sought to put the right measures in at the right time. We will not hesitate to go further if that is what the scientific and medical advice tells us we must do. It's important for me to level with you. We know things will get worse before they get better. But we are making the right preparations. And the more we all follow the rules, the fewer lives will be lost and the sooner life can return to normal. I want to thank everyone who is working flat out to beat the virus, in particular the staff of our fantastic NHS and care sectors across England, Scotland, Wales and Northern Ireland. It has been truly inspirational. Say our doctors, nurses and other carers rise magnificently to the needs of the hour. And then he talks about retired nurses and doctors returning to work. So it's going to get worse before it gets better, but it will get better. Now I think I'll leave that for there. I'm going to come back now in a minute and do a more detailed update of the United States and Australia.